Welcome to the EULAR 75th anniversary session. This is a very important congress for EULAR because we celebrate the anniversary of our organization that started in Copenhagen in 1947. My role as EULAR president is to discuss and present to you what are our activities currently. Those are my disclosures. So EULAR is delivering many activities and many actions that are based on our history in the past and that we will bring us to the future of EULAR. The EULAR is the pan-European organization that includes the organizations representing the national scientific societies in Europe in rheumatology, but also the associations of health professionals in rheumatology and the societies of people with rheumatic and musculoskeletal diseases. But for us, 2022 is a very important year because it represents a remarkable milestone not only to the contribution of medical advances in rheumatology, but also for the development and maintenance and adherence of a scientific organization for the last 75 years that is dedicated to improving the lives of people with those pathologies. What is the mission of EULAR? EULAR aims at reducing the impact of rheumatic and musculoskeletal diseases on the individual and the society, and to improve the social position of those who are affected by those pathologies, but also their quality of life. And to this end, EULAR promotes and works on different areas that are education, research, advocacy, prevention and treatment of rheumatic and musculoskeletal diseases. Several advances have brought to changes in the past with rheumatology that has taken a leadership role in the field of clinical medicine. But in the modern age, EULAR has a head position also in the delivering of excellence in different areas, particularly in education, but also in research, in advocacy, also in the area of standard of care, and in many other activities that I will now present to you. But what is important for us is that EULAR work together in three big pillars that represent our associations, and they work in alliance over many generations. The three pillars are the societies of people with rheumatic and musculoskeletal diseases, the societies of health professional rheumatology, and the scientific societies in rheumatology in Europe. And all together, we are celebrating this milestone anniversary in Copenhagen, that is the city where everything started 75 years ago. EULAR works on numerous activities. The historical activity of EULAR is education. And the aim of EULAR education is to foster professional and patient training and education by developing material that is tailored for the different individuals. We have courses, programs, and different offerings that is specifically addressed to the different areas of people that work in the field of rheumatology. We also offer this material in a very innovative way with an innovative learning approach. And we facilitate the access to these activities and these offers, and we also foster and contribute to the harmonization of education standards in Europe in rheumatology. Different areas are now the core areas that are developed by the EULAR School of Rheumatology, that is the vehicle of EULAR education. Particularly, we offer online courses, we offer live courses and physical events and meetings. We have also the educational content to the EULAR Annual Congress. We also can give the endorsement of EULAR to courses or meetings that meet specific requirements. For young individuals or for specific group of people, we give bursaries, grants, and exchange opportunities. So we also have many publications with journals, our very prestigious journals that publish our recommendations and main research outcomes. And we also have textbooks for those who are interested to work and study in different areas. But there are a lot of materials that are for free presented in our website. And within the school, all educational products can be utilized either free of charge or at a very limited amount of money. Another very important area that represents a crucial activity for EULAR is EULAR research. Well, the research is developed within EULAR to offer the possibility to improve the research activities for different researchers in Europe, but also for stimulating the collaborative research among different groups of people or among individuals who work in the field of rheumatology. We also work in the research group to disseminate the latest research in RMD by publishing leading scientific journals. The EULAR Research Center is the vehicle of EULAR research, and it works in order to bring researchers together to alleviate and prevent rheumatic diseases on human lives by empowering research and innovation across Europe. But also it stimulates the collaborative research, and finally the Research Center is the leading supporter of rheumatology research in Europe and also overseas. So EULAR takes a number of actions for informing the stakeholders on the importance of rheumatic and musculoskeletal diseases in Europe at a national level, and it takes actions also in collaborations with other organizations in Europe, for example, the Biomedical Alliance. And this year it had an important role on the development of the pharmaceutical strategy, but also in the field of safety at work for rheumatic and musculoskeletal diseases. EULAR quality of care is another very interesting activity that EULAR develops, and this is done for improving and implementing the standards of care for people with these pathologies, but also for promoting and improving the access to care for patients, and improving the communication between professionals and people with rheumatic and musculoskeletal diseases. EULAR develops, publishes, and promotes recommendations, criteria for the classification, the diagnosis, and the management of musculoskeletal diseases. And the quality of care actions are done also for some projects in collaborations with other societies, for example, the American College of Rheumatology, but also we promote the diffusion and the publication of classification and diagnostic criteria or response criteria, recommendations for reporting and conducting clinical trials, management recommendations that are very appreciated and diffused worldwide, recommendations and initiatives in collaborations with other societies, and also lay summaries. Another important activity of EULAR is the EULAR Congress. The EULAR Congress is organized annually in a different city in Europe, and it presents the highest scientific standards and innovation. It has a very high reputation worldwide, and it offers different areas of knowledge for those who are interested and participate in our Congress. Until the year 2000, the congresses were organized every 4 years with smaller sized symposia in between. But starting from the year 2000, the Congress takes place yearly in a capital or in a city in Europe, and it has become the primary platform for exchange of scientific and clinical information in Europe. So in addition to the presentation and the program of the Congress, we also have a very important forum for interaction, for networking among different people who represent the community of EULAR. So this is done in the area of rheumatologists, but also with patients, with colleagues, with professionals in general, and also with the representative of the pharmaceutical industry worldwide. The EULAR Congress, it takes place every year in June, and we are here in 2022 in Copenhagen. But we have also a number of communities that work within EULAR. Our communities are very active, and they represent a very important network of people collaborating each other and stimulating new projects and new activities. One of them is EMUNET. EMUNET is the community of young rheumatologists who are the generation that contribute to all our EULAR activities. Another important community is EULAR HPR. This is a network of national organizations of health professionals in rheumatology across Europe, and they serve as a platform for interactions and for sharing information among the different societies and the different groups of health professionals working in rheumatology. And they also promote the multidisciplinary approach and collaboration in the treatment of rheumatic diseases in Europe. EULAR Pediatric, this is another community that works in this case in collaboration with PRESS, the European Society for Pediatric Rheumatology. And in this context, they work in the field of rheumatic and autoinflammatory diseases affecting children and young people. EULAR PARE, this is the network of national organizations of people with rheumatic and musculoskeletal diseases. They work together, united in a collaborative manner to promote the concept that the importance of rheumatic and musculoskeletal diseases is heard, and it has an influence among decision makers in Europe. And they create a very powerful alliances in different collaborations in our continent. We have different members that take part in EULAR activities. We have corporate members, scientific societies, these associations of people with rheumatic and musculoskeletal diseases, and those associations of health professionals in rheumatology. And these represent 45 nations in the European area. EULAR has a very important strategy that is developed every 5 years, and it is also based on collaborations and on numerous activities. In these 5 years, from 2018 to 2023, EULAR is working on the current strategy, and the first strategic aim states that by 2023, EULAR will be the leading provider for education in rheumatic and musculoskeletal diseases, but also it will provide the foremost Rheumatic Disease Congress experience. It will deliver preeminent comprehensive quality of care frameworks for the management of people with those pathologies. It will have established a European Centers for Research to advance and high-quality collaborative research. By 2023, EULAR will also work in the area of advocacy, and it will have increased the participation in work by people with RMDs with different important actions. And EULAR also will have established a governance that will, and an infrastructure that will be able to deliver those strategic objectives. The EULAR governance is completely new, and starting from this year we have a completely new way of government of our association. We have a board that is composed of four rheumatologists. We have a president-elect, a past president, and a treasurer, and we have the vice presidents of the 3 pillars, representing the 3 pillars of EULAR: the scientific societies, the societies of patients, and the societies of health professionals in rheumatology. The council is composed of different committees that work all together with the development of different actions that are aimed at meeting our strategic aims. And all this is then organized and supported by a very efficient and excellent secretariat that is composed by competent persons that work together under the leadership of an executive director. They work for the delivering of those strategic aims that are and the delivering of the different projects. We have a very strict and dense collaborations with the scientific societies, with the patient societies, and with the health professional societies, but also with partners from other continents. And these international collaborations strengthen the actions of EULAR and make it be a very important organization, not only in Europe, but also in other areas of our globe. All our activities and actions are done under the concept of the EULAR family. The EULAR family is the heart of our organization, and it is represented by a team of people working together across the three pillars: medical, health professional, and patients' organizations. We work under the concept of inclusion, equity, geographic distribution, and meritocracy that are the basic principles of our actions and activities. In the past, EULAR was felt a little bit far away from the communities, from people who work actively in rheumatology, in the daily life and in the daily activities. But with a radical revision of our structure and our organization and our governance, there are now the three pillars that work in a very inclusive manner, and in order to engage any individual who is willing to work within EULAR in the different activities. Any person nowadays who is part of the community and is willing to participate as a volunteer in the EULAR family can be involved in its numerous initiatives, with individuals that are appointed because of their positions of responsibility, because they want to contribute to the different activities, because of their skills and their ability to work, but independently of gender, age, of geographic origin. So in the last years, the concept of inclusion and meritocracy and equity are representing the main activities and the main concept that are based on which our work is based. So as I said, every 5 years EULAR works on a different area, different strategy, and in the period 2024-2028 we will present for that time a new strategy that will be announced in June 2023 at the next EULAR Congress. But in the modern era, EULAR had also important challenges to solve. In the 2 years, 2020 and 2022, two very important events happened. The first, the COVID-19 pandemic, and then very recently, the war in Ukraine. During the pandemic period, EULAR developed many initiatives that were aimed at supporting those afflicted by rheumatic diseases in these difficult times. Particularly we started to work on the recommendations, and a task force was convened in order to publish the recommendations for the management of rheumatic and musculoskeletal diseases in the context of the pandemic. And these recommendations were also updated when there were more evidence in the literature. At the same time, after these first months, EULAR published the viewpoints on the vaccination to SARS-CoV-2 in patients with rheumatic and musculoskeletal diseases, and this was also updated more recently. But in the period of the COVID-19 pandemic, EULAR advocacy also promoted a number of very important actions. At first, EULAR called on governments in Europe to recognize the most vulnerable during the COVID-19 pandemic. It worked for the identifications of patients whose therapies could be affected during the pandemic. It worked for ensuring that there was a flexibility for ensuring access to medical advice to patients with these pathologies, and to ensure the access to medicines during the pandemic. And also EULAR worked for solving workplace challenges for those with an RMD. It also published a number of materials, infographic, webinars, in order to inform clinicians and patients on what the actions to take during the pandemic. And so we had the repositories for clinicians and the repositories for patients. We also worked on two different registries, the COVID-19 registry and the COVAX registry. These two registries were developed with the aim of collecting data to address the lack of information on the relationships between COVID-19 outcomes and rheumatic and diseases patients, and also their treatments, and also to collect data on vaccinations for those patients. This initiative was developed in collaboration with the Global Rheumatology Alliance and with the PRESS, the European Association of Pediatric Rheumatology. The COVID-19 pandemic was also a challenge for our Congress because in 2020 and 2021 our annual Congress was transformed into a virtual event. A few weeks before the physical Congress that was already planned and organized, we had to modify our delivering of the Congress and transform it into a virtual event. And the same was for 2021, but this was an enormous success that included and involved a very high number of delegates, the more delegates than ever before, with 18,000 people attending our Congress virtually in 2020 and more than 17,000 delegates in 2021, and they came from more than 140 countries. And this year we have a new challenge because we are enthusiastically announcing and working on the hybrid Congress. That is the first year that we have a combination of virtual Congress and physical event that is taking place in these days in Copenhagen. The second challenge is the war in Ukraine. The war in Ukraine is a war in our continents where EULAR is working, and EULAR is a society that stands for peace. So we are committed to the tradition of humanity and peace, and we are concerned about the general situation of the world. So we made a number of actions for our community and our patients with rheumatic and musculoskeletal diseases, and for all our pillars work in Europe. We coordinated the support to the population that was afflicted through our EULAR members. We gave a financial and professional support to the patients with rheumatic and musculoskeletal diseases who were in Ukraine, but also in other countries to the refugees, and we supported the Ukrainian rheumatologists for having the possibility to treat those patients, to visit those patients. We also had a restriction to the delegates coming in presence to the Congress, those delegates from Russia and Belarus, and we gave a free registration to the Ukrainian nationals to the Congress, to the virtual Congress, but also to all our online activities and courses. So EULAR in the modern age is a new organization, a new alliance, and the EULAR Congress in particular has become the flagship of EULAR and a forum for innovation in rheumatology. 2022 particularly is an extraordinary year for EULAR, not only because of our 75th anniversary, but also because it represents our first ever hybrid Congress. So we welcome you all to our Congress, those who are connected virtually and those who are here in presence. And thank you for your support to EULAR in our mission to improve the lives of people with rheumatic and musculoskeletal diseases.